Respiratory Diseases, Croup, by Ariana and Rita. Table of Contents. Look for the underlined indicators for the answers. It may be read. 1. So what is croup? Croup is a respiratory disease that obstructs the respiratory tracts due to swelling in some of those parts. It's commonly seen in children 3 months to 5 years of age due to their smaller and undeveloped tracts, therefore being rare to adults since the swell would affect breathing less. The inflammation leads to a dog-like barking, hoarseness, and difficulty breathing. Viruses are the most common cause of croup, like the parainfluenza virus. It's a broad term to describe groups of infectious pathogens that produce usual respiratory diseases, but it may also be because of allergies or just reflux from the stomach. More swelling means more problems breathing, so it's important for parents to monitor and discern their child's condition. 2. The viruses that lead to croup initially infect the nose and the pharynx, showing up as regular cold symptoms like runny nose or fever. This starts in the upper respiratory tract, but croup is what happens when the infection spreads to the larynx, the vocal cords, and inflames it. This causes that hoarse change in the voice and barking cough of croup. Then croup affects down to the lower respiratory tract. Swelling occurs in the trachea, the windpipe. This is what restricts airflow and makes it difficult to breathe. In more severe cases, swelling can extend into the bronchi, the airways, a major air passage from the trachea to the lungs. A quick diagram to explain croup visually. Croup affects the upper respiratory tract, but only specifically the larynx, and it also affects the lower respiratory tract with the trachea and bronchi in severe cases, which is a potential danger for the lungs. 3. Croup is typically diagnosed through a combination of medical history. The general practitioner will ask about the child's symptoms, checking off the characteristics of croup that were said before, and the doctor will perform their own visual inspection. Signs of children with severe respiratory distress may become restless, anxious, or agitated, which can further increase the airway narrowing, making it even more difficult to breathe. And a physical examination. During the physical exam, they will listen for stridor, a high-pitched whistling sound most often heard during inspiration and expiration. Respiratory rate will be measured. High rates and low oxygen levels are usually linked to patients with croup, while additional tests like a neck x-ray, chest x-ray, or both may be ordered for more critical states. The diagnosis is usually straightforward based on the clinical presentation, meaning what is shown. 4. Modern treatments. The primary treatment for croup involves taking medications based on what the patient needs. Antipyretics, a substance that reduces high temperatures like acetaminophen, Tylenol, or ibuprofen, Advil, can be given during that first stage of the disease, dealing with the ordinary cold and aiding in comfort. Corticosteroids, a prescription med that reduces inflammation in the body, are a human-made substance that is similar to cortisol, a hormone your body naturally produces. An example of this med is dexamethasone. Specifically, it would help reduce the inflamed in the airways. This solution takes a longer onset of action, but it has lasting effects. In life-threatening croup, a quick solution for immediate relief is epinephrine. It is the hormone adrenaline that the body naturally produces, but made as a substance to help regulate organ functions. This effect would open up the airways, relieving breathing difficulties. You can use this medication through inhalation by nebulized epinephrine. Those last two medications work through vasoconstriction, narrowing of blood vessels, reducing blood flow, but it leads to a decreased mucosal edema, the swelling of our mucous membranes. Vasoconstriction is helpful indirectly because it improves symptoms, but still it has that vasoconstrictive effect, therefore shouldn't be used as a standalone treatment for croup. Complementary treatment. Exposing the child to cool or moist air can offer relief, such as a steamy bathroom, cool air outside, or a humidifier, they all can soothe the throat and reduce coughing. Keeping the child calm and comfortable is also essential, as stress can worsen symptoms. Alternative treatment. While scientific evidence is limited, parents can also explore herbal remedies or homeopathy. However, it's important to consult a healthcare professional before trying any alternative treatments to ensure they are safe and appropriate for the child. 5. The future prognosis for children who experience croup is generally positive because croup is often mild. It may be a self-limiting condition that typically resolves on its own within a few days to a week with appropriate care. If it doesn't resolve on its own, a short course of oral medication will be prescribed, like dexamethasone, epinephrine, once talked about in modern treatment, are an option. In a more dangerous case is if the epiglottis, the tissue that covers the trachea, becomes infected, the entire trachea can swell shut. That is an airway blockage that should be treated right away medically, or else it might lead to a stop in breathing completely. 6. Issues connected to croup. Culturally, beliefs about health and illness can affect how families perceive and respond to croup. In some cultures, traditional remedies may be preferred over primary treatments, potentially delaying appropriate care. Sociologically, families in lower socioeconomic situations may face barriers to receiving medical care, which, if not treated promptly, can be a complication. Education about the condition is also crucial. Communities who are able to gain information in order to maintain good health are more likely to recognize symptoms early and seek help, whereas those who don't easily have that access. Environmentally, facts such as air quality can impact respiratory health. Living in areas with high pollution levels can increase the risk of respiratory infections, which may lead to more cases of croup disease. Seasonal changes can also affect the incidence of croup, as it is more common during fall and winter when respiratory viruses circulate more widely. What croup sounds like. Sources: